Before I get started, I wanted to say that I was a finalist in the astronaut program. I interviewed with two of the people who were killed 15 years ago today, and I'm very confident that they would applaud each and every one of you for being here and thank each and every one of you for being here, for the innovators, for developing these enabling technologies, for NASA for supporting this program, for the funders of these programs. I know in my heart that they are smiling down on us today. Thank you. I have a long history with NASA. I was a summer intern with NASA when I was a medical student. Great experience. I got to fly on that KC-135 Vomit Comet. I am a serial inventor. This was one of my early inventions with NASA, got funded by NASA, is actually planned into some of the Mars spacecraft. It's a self-powered human centrifuge. I took my orthopedic surgery knowledge with bones and joints, understood we could get artificial gravity, exercise at the same time with a launch weight of about 15 pounds. Actually has a counter-rotating mass as a rotor to generate electricity. But I'm really, really more excited about the Germfalcon. It's called the Germfalcon because it's, as you'll see, a winged predator of germs. And what this does is it kills germs on airplanes. And not only excited, what really excites me about this is that we know that influenza kills hundreds of thousands of people around the world. It comes every year. And as a physician, I really feel we have the opportunity to save hundreds of thousands of lives with this technology. My father was a plumber, and when I became a doctor, he said, you know, plumbers have saved more lives than doctors. And that's actually true through sanitation, and that's really what we're talking about today. If you think about disease transmission, infectious disease transmission, over the millennia, there have been natural barriers, time, distance, oceans, mountains, deserts, that have prevented the spread of disease. The miracle of commercial aviation has obliterated those barriers. What we seek to do is to reinstate those barriers by sanitizing airplanes. People care about this. We've seen this on airplanes. We did a survey, almost 1,200 passengers, and said, have you gotten sick from germs on an airplane? 4 out of 5 people believe they have. Who makes a product where 4 out of 5 people get sick using it? Tobacco, okay. But I mean, think about it. And we asked how important it is. And you know, 0 to 10 scale, better than 9 out of 10. People really do care about this. These are actually cultures from an airplane. And if anybody's interested, we have some culture plates we're giving away. You can test your airplane on the flight home if you don't believe me. Happy to do that. But what Travel Math found was that they'd cultured airplanes. We found similar things in culturing airplanes, that the tray table is 8 times worse than the toilet flush button. Scary that these germs survive on airplanes for a week. So think about it. If the airplane you're flying on flies 4 flights per day, that means you're sharing that passenger space with 30 people. Forget about the lavatory. I mean, just where you're sitting with 30 people's germs. CDC and the National Institute of Occupational Safety Health did a study, and what they showed is that flight attendants get sick twice as often as school teachers, 4 times as often as age-matched controlled office workers. Harvard and MIT did really a landmark study. And what they did is they looked at data from the International Air Transport Authority, and they looked at data from the CDC, specifically for influenza. And what they found is the busier the airlines are between Thanksgiving and Christmas, the worse the flu season. It occurs earlier, more deaths attributable to flu, more hospital admissions. And even after 9/11, when they shut down our air transport system for 2 weeks, the flu arrived 3 weeks later than usual. What are we going through now? Airlines year over year, 8% increase in passenger miles, what they call the load factor, the number of seats, record levels in October and November of 2017. Look at our flu season, one of the worst ones on records. But what's really interesting about this flu season is that the first year the entire US has had elevated activity at the same time. How's that virus going across the country? Not the internet, okay? It's a different kind of virus. I mean, it's gotta be airplanes. Here's an actual case of disease spread on an airplane. Norovirus, which is usually associated with cruise ships. A passenger vomited on the airplane. They knew they had norovirus. The airline took extraordinary measures to clean the aircraft. Okay? Over the next 5 days, there were 66 flight attendants who worked on that airplane. 43% of them contracted norovirus. Okay? You think the airline polled the passengers who were on that airplane? No, they didn't. What do you think happened to them? 4 weeks ago in the Wall Street Journal, okay, we've all experienced this. They're cramping more and more people into the airplane. Okay? That's great for airline revenue. I get that. Okay? It's not so great for passengers, but the real benefactors are the germs. So what's the solution? Honestly, we borrowed existing healthcare technology. We see devices that are used to sanitize rooms, overhead lights in the operating room, lights in the microbiology lab. This is ultraviolet C-band light. And what that is that it's a specific frequency or wavelength of light that kills germs. It zaps their DNA, causes these irreversible bonds in the DNA that are called dimers, and we're dimer LLC, not a coincidence. But it really kills and it activates all viruses and bacteria instantly. But not only that, what it's been shown in hospitals, not just to kill germs, but to actually lower hospital-acquired infection rates. And we think that those data are going to be translatable to the airline passenger market. Now we're going to do a little demo. And this is our company president, and proudly my son. So these are fake UVC lights, so no worries about the eyes or anything. So in this mode, this is what we call the seating area mode. And you'll notice the wings can extend fully to get 3 seats, or you can do 2 seats or 1 seat. This side has real UVC lights on. We're not going to turn it on. It's got we can adjust the height of the wings. There's a little laser. You can safely do the laser here. I think that tells the operator the exact height of the wing before it's deployed. Notice that there, let me come down. Turn the lights on. Good. Keep the lights on the right side. So these lights get the overhead bins. There are lights that shine up here to get your overhead controls. Okay. We get all the way out to the window and the window shade here, the seats, the tray tables. There are floor lamps here that get that. There's also a very strong fan. I know it's hard for those people to see in the back. And what that does is blow the dust out from underneath the seats, so it gets all of the dust and germs from underneath the seats and sanitizes those as well. Additionally, we have what we call the lavatory mode, where we retract the left wing. Okay, all right. And then what we do is just we lower that up and down when we get into the lavatory. Okay. And we fold that up. And we have what we call galley mode. And in galley mode, turn it on, that just goes along the back side of the galley, so we can get all the components of the aircraft. We also feature a battery that will sanitize about 6 airplanes on 1 charge, and it's swappable if they need to do that too. This shield protects the operator from any UVC lamp. It gives you complete protection. UVC can be a little bit harmful to skin and eyes. So we're done with that. You can pull that back. Thank you. It's fast. Okay? On a 737, for example, we can get a 99% kill in 3 minutes up and down the aisle. Okay? If you're willing to spend 12 minutes, we can get a 99.99% kill on all of these surfaces, including the lavatories and galleys. We presented a show in Hamburg, an airline industry show. The BBC called us the best innovation in aviation. We've met some challenges. We have great intellectual property, 4 US utility patents issued, 1 in Europe now, and a couple more pending. We validated our data both in terms of UVC output and in actual culture germ kill rates. There's no effective competition. In fairness to the airlines, there has never, ever been a way to sanitize an aircraft efficiently. The wipes take way too long. They're not very efficient. So there is no competition. This device fully complies with all relevant agencies. So we're good to go. What's our main barrier to entry? The airlines kind of pretend that they don't have a problem. Now, I know what you're thinking is that they're just in it for the money and they don't care about their passengers, they don't care about their crews. But I'm going to show you that it is actually going to be a moneymaker for the airlines. But this begs the question, should there be regulations requiring airlines to sanitize? Because believe it or not, there are none. There are no regulations. The Starbucks at the terminal, yes. The airplane, none whatsoever. Okay. We asked our survey, should the airlines be required? 96.5% of people said yes. What else in this country do 96.5% of people agree on? We talked to a Wall Street Journal reporter, and he said, I can't believe there are no regulations. So he called the FAA, and the FAA said, well, no, I mean, we consider hazardous substance like battery acids. Ebola, that's not really a hazardous substance. OSHA, so they said, call OSHA. And OSHA said, well, we don't really have jurisdiction on the airplane. You know, if it's the van that takes the flight attendants to the hotel, yeah, we have jurisdiction over that. They have no jurisdiction on the airplane. Go back to the FAA. The FAA said, well, how about the FDA? The FDA said, we do food and water, but not really sanitizing the aircraft. Go back and talk to the FAA. He called it a regulatory quagmire, which is really what it is. We talked to a member of Congress, and he said, come on, there are no regulations? And he assigned the GAO, and they talked about air travel, communicable diseases, and they said, hey, we need a plan. So it's ripe for legislation. Argentina is the first country who is actually requiring airplanes be sanitized now. One of our team members is down in Buenos Aires right now meeting with the national airline in Argentina. But we don't believe in regulations. We believe this product should stand on its own without regulations. Okay? And this is the value proposition to the airlines. First, passenger satisfaction. Even taking aside throwing passengers off planes, it's better to throw germs off planes. But you know, you remember in the old motels, they had that paper band around the toilet seat that says, sanitize for your protection, right? It made you feel good. It said, hey, this facility cares about me. So it's a big customer satisfaction thing. The airlines could use that. Second, this is a mock Expedia page. Similar flights, okay? The price is $2 or $3 more for a certified sanitized flight. Are you going to pick that? We did ask that question in the survey. And what we found is that people are willing to spend an average of $3.86. More than half the people are willing to spend $5 or more to sit in a sanitized seat. Not surprising. If they even charge $1, okay, only about 1 in 10 are going to balk about that. Okay, what does it cost the airline, amortized over the cost? 9 cents a seat. So if the airline chooses to charge $1, they're going to make a lot of money on this. So there's money, especially for the early adopters. A really important factor is what we call their mitigation of loss during outbreaks. And by the way, we kill Ebola, MERS, SARS very easily. But when there's one of these outbreaks, the airlines lose a lot of money, there are a lot of canceled flights, travel goes down, their stock prices dip. We want to change the whole mindset. The airline is no longer full of germs. Okay, that's the cleanest part of the travel experience. So just to review this, because it's important, it's a public relations coup for them, increased market share, particularly for early adopters, profit per seat, and they can mitigate their pandemic losses. We don't need legislation to move forward. But here's the real cost, and actually I took this quote from somebody sitting next to me. There's a big push in passenger experience now for faster Wi-Fi. And the fact is, if your kid is sick 3 days after your flight, you don't care how fast the Wi-Fi was. So it's a big market. Okay, and you know we're looking to put one Germfalcon at virtually every gate. So 200,000 gates, 50,000 a unit. It's going to cost about $15,000 to build these, so there's good money in it. But we're going beyond aviation. Okay, we want healthcare, cruise ships. They're actually sanitizing the Super Bowl game. So movie theaters, sports arenas, etc. Here's the other core members of our team, my son Mo. Melissa is our majority shareholder. We're a women business enterprise. We have a great advisory board, people from airline industry, people from import-export, some kind of a CEO coach. Dr. Leonard Rommel, some of the NASA people may recognize that name. He kind of wrote a very landmark article about infection control during prolonged human space travel. And I would like to introduce a little teaser for the NASA folks. This is a Germfalcon, we call it the GermRover, for spacecraft. And this would float around the spacecraft with lights, these are fake again, that would just hover along and be propelled. I say this is what happens when you crash your drone into your Roomba. So, and the idea is that they would go into a docking station and it could sanitize the interior of space shuttle, a space station. What they're doing now are wipes. Wipes are a problem because A, they're not very effective, but they have to launch them and they have to bring them back down. So this would be a great program for that. So thank you very much. Happy to entertain any questions.
Great presentation. Clearly this is widely used in hospital settings, so I think the application in the airline industry is very unique and necessary. So I have a couple questions. One is, when you've done your testing in airplanes, and I'm assuming that the data that you presented is from actual airplanes, what's your surface coverage, and what are the areas that are tougher to get to when you're testing and see where the infection is or where the bugs are?
I can tell you the most contaminated area is the tops of the seat backs along the aisle, because everybody touches that as they go out, and we get great coverage there. So what we do is we do one pass with the tray tables up and one pass with the tray tables down, so you get both sides of the same. Same with the armrests, the overhead shades, the bins and the window shades. So we get all those surfaces. And there's really nothing to stuff. The floor is a little bit tough, but you tend not to eat off the floor that much on an airplane.
There are floor lamps at the bottom of the machine. And really all the nooks and crannies we do a really good job on if you're doing the two-sided operation. But we also recommend not shoving your fingers in the little cracks between the seats.
And the other question that I have is, what about the cockpit? Do you have access to that? I don't know the regulations. And
it's interesting, and the pilots will tell you they don't want anybody in their cockpit. They clean their own cockpits. They don't want the cleaning crews. They don't want them messing with the buttons and the gauges and everything else. They're really particular about that. They want the back of the airplane sanitized because they use the lavatory and they use other things too. So, but not the cockpit itself. Good question.
So great presentations, and by the way, for the rest of the audience, I had the privilege to spend a one-on-one fireside chat last night, so I know a lot of things about Gerfalcon, but also give me the night to think, with more precise question. I have a lot.
You're scaring me now.
No, so I think you guys, what you did, so the innovation here, it's not on the technology per se, keep me honest, but in the use case. Where you're going to apply technology, right? And I agree with you. Your best shot is with the airlines, but the airline industry is one of the toughest industry ever. There is no innovation whatsoever for the last 40 years. Literally, 40 years ago, to fly from London Heathrow to New York, it took you the same time. 40 years later, most likely with the same airplane, which is a 747. Right? And the reason why it's a tough industry to innovate, because those guys, they really operate into an environment with 2-3% margin. So when you have that type of shallow water, it's really, really hard to figure it out, right? So I think that the reason why, they see the value, but they can't really afford, unless you will not be able to unlock the first mover. The good thing is in your go-to-market that if you unlock one, everyone else will be also forced to jump on the wagon. But what's your go-to-market model? And what I'm interested, what's your pricing model, right? Is this something expensive that really they will jump with you only if they are forced to, either by regulator or by the first mover? And how do you charge? What's the charging model? It is an as-a-service subscription so that the airline doesn't need to invest CapEx up front, or they have to buy the trolley and they have to do in a training. Drive me a little bit into the go-to-market pricing strategy.
So that's a loaded question.
Sorry, yeah.
We'd like to do some of this off camera at the table. But go ahead and give us.
So that's a loaded question. We as far as airlines go, you're right. Our biggest competition in that industry, in that sector, is absolutely inertia, and they don't currently have any standards or regulations requiring them to do any onboard cleaning. In Argentina, we're seeing the first regulations of that type coming out, and we're trying to kind of encourage our legislators here to work on something like that. I'm not sure if the White House Office of Innovation made it here today, but I was hoping to have a conversation with them. As far as going to market in other areas, it works great in healthcare. It works great in hotels, cruise ships, trains, buses, classrooms, and there are plenty of other markets that we are kind of starting to explore now. As far as airlines go, we've had airlines who are very, very interested. As of now, it's not really a priority. even though right now it's flu season, I think it is starting to become a priority, and I think we have a pretty good opportunity now for somebody to jump on. But I mean, our goal was to be ready and installed prior to this flu season, so it's a little disappointing that we're not in there yet, but we are at the moment offering free sanitization to any airline that wants it.
Our go-to-market thing, we'd like to discuss at the tables with you.
Sure.
Good presentation. Thank you for coming. Who's your third-party validator to show that you have these decreases?
So most of our
Well,
studies...
that's a technical question. There are data that are very clear in the literature. In fact, I have a notebook here with the data that show, here's the UVC output that's required to kill this particular species of germs at particular log kill rate. Those data are known and published.
Gotcha.
And
But
all
who
we
are
have
you
to do is
using
put a
to validate?
UVC meter.
Yeah,
in
but
the lab.
do you have an independent validator that's
Yes,
testing?
we have one of our, in fact, this machine is going back to Pennsylvania. A group called ECRI that evaluates devices for hospitals is doing that third-party validation right now.
And what have you shown with the flu season you discussed? Which viruses are decreasing viral load on these?
Oh, this kills them all.
Okay. And the last one, there's been a lot of recent studies have come out that the actual airports are about 1 million times dirtier than the airplanes.
Yes.
I think they talked about the touch pads have like 200,000 CFUs on average and up to 1 million CFUs in the dirtiest stations where the bathrooms are just 90,000.
It's a valid point. There are two things. In an airport terminal, there's time to clean. Okay?
But they don't clean it.
But that's a different issue, but they have time. It's different than an aircraft. The other thing is that little kiosk sits at LaGuardia, okay? That airplane could have been in Ghana yesterday. I mean, you're right, it's not just the number of CFUs, it's what it's packing.
Gotcha. Thank you.
Hey, thanks. You had a slide bullet on there about that your product complies with, and there was a whole list. There was FCC, which I really perked up on for that, but FAA and some others, which would be very reassuring for someone wanting to partner with you. But I want to give you a chance to talk more about what exactly have you gotten compliance certification?
There's no certification required. The FCC is just a matter of the electromagnetic interference. And that's easy. We're using all those components already, and we're shielded in metal. Okay, and we're getting some testing done to formalize that, but that's not a problem. The FAA says as long as you are on and off the airplane, we don't get involved, before the doors close. FDA, they use ultraviolet light to sanitize other devices. FDA, same thing with the EPA, that's all approved. UL, we don't have to worry about because we're battery operated. So we've got full compliance. There are no obstacles there.
Is there an OSHA one that needs to be there as well because the operator present with the UVC?
No, there's a recommendation by the National Research Testing Lab Association, and we're going to go through that testing too. But that's part of what that ECRI group is evaluating now too, because they're for the hospital workers, and it'd be the same for an airline worker.
Did you say you were able to shield UVC?
Oh yeah, with that
So,
plastic,
yeah,
that vinyl.
That's what I was,
The UVC shield, you have to open it in order to even access any of the controls. And once you're inside that shield, you are completely protected from UV, and as soon as you take your hands off the handlebars, the lights turn off.
Yeah, it's a release. It's a quick release. So if you try to step outside the shield, they shut off. And these are all 5-sided boxes, so all the light goes away from the operator. You don't want anybody else in the airplane. About 3 rows away, you're safe.
well played.
Thank you. Good question. I didn't plant that.
You guys are making me want to wear a suit of armor tonight when I go to LaGuardia. But
I have hand wipes. I have hand wipes in my backpack.
Hand wipes and take one of these guys.
You might all want them passing that microphone around.
The studies we did show LaGuardia is one of the worst places to depart from, actually.
I wanted to ask about the air ductwork,
Yes.
where there's bound to be, that's
Let
the
me- let me-
transportation mechanism within the plane. So
Yes.
is there anything you can do to help that as well?
First of all, some of the newer aircraft, they all use HEPA filters. The Boeing 787 actually now uses UVC within their air filtration system. So it's already known. They actually pump water on through a UVC chamber also to sanitize the water as it comes on board. There's an artificial separation between the air and the surface. And people say, oh, is this just surface or is it air? That's one of the reasons we use the fan. But if you think about it, in the air, the germs live on tiny dust particles. those dust particles will settle on a surface. Now all of a sudden surface contamination, you walk by, now all of a sudden it's air contamination. It's kind of an artificial separation, but the best air in the airplane is that coming out of the nozzle.
So in other words, there are people currently working in commercial aircrafts and using UVC, and they did not think of this.
I also wanted to ask, just sort of, we're familiar with the little personal wands that could do something similar too. That might be a little bit cheaper approach. Just share.
Sure.
You
Well,
know,
they're
why
very
pros,
weak.
cons.
To do an airplane with a wand would take you about a month, because again, the UVC can be harmful if you look at it a lot. So they purposely make those very weak. You have to put it right against the surface and go very, very slowly. That would take a long time in an airplane. We want to be on and off the craft in 3 minutes.
We're using the strongest lamps available, and those are not the same lamps that they use on the wands. And that's also why we have the shield built in, is it kind of allows us to use those extremely strong.
Why we're using the
UVC
fake
lamps.
UVCs for demos.
Yeah.
You may want to make your own version of a wand for those more acute incidents of someone vomiting while in the air and you can't get your device in there, and they can deal with
They
the
spray.
issue.
They spray now, which is
They
probably
just
just as
spray
effective.
instead.
So they use UVC sometimes in spacecraft sterilization, and I know that there are some things that are hard to kill. Have you done a study look at what's hard to kill on airplanes?
We've focused on human pathogens, which is a little different than a spacecraft. So there are, the reality is in the world of germs, there's just a small sliver that are adverse to human beings. And so our focus has been on killing those that make people sick. It's a valid point. And virtually all microbiology, almost all microorganisms are UVC sensitive. It's a matter of the dose. And so if you give them enough of these millijoules per centimeter squared, you are going to kill them. But some, especially what are called spore formers like Clostridia, are more difficult to kill.
Thank you.
So what prevents a fast follower from catching up to you and surpassing you?
We
What are
have
you doing to
Four
have-
great patents.
We have very strong patents issued, and it would take redesign from scratch, and you'd probably have to license our patents to do it legally.
And we'll have copies of the patents at the tables.
Well, I want this on every plane I ever go on in the future. And we've talked about this. If you don't make headway soon with the airlines, how quickly are you prepared to sort of start venturing into one of the other categories that you mentioned, and how easily adaptable is your technology and your patents to the form factors that you would need to approach these other verticals?
Yeah, our intellectual property protects all of the venues we mentioned. So healthcare, prisons, schools, all these. And so, yes, we are, in fact, like I said, this unit is being evaluated at this facility that kind of does consumer reports for hospitals. Of the hospital units that are out there, and there are 4 or 5 big players in that field, they typically take 30 to 40 minutes to sanitize a room. In my own operating room, I've used this and gotten a 99.99% kill on all the relevant surfaces in 3 minutes. Because it's for some technical reasons, it's much better, much faster.
We specifically built this to fit in the interior of an airplane, and in order to do that, we had to build these wings and this variable height extension. And by doing that, we really ended up building something that would very easily sanitize even this room. It works perfectly in an airplane, but it works anywhere.
Have you considered a home version of it?
Absolutely. We intend to build a household unit, hopefully in the foreseeable future.
I just have another quick question. So, you mentioned something about using this technology to decontaminate airplanes and thereby implying that you will then reduce potential rates of transmission of different organisms. But the reality is that some of that is through surface transmission. And yes, these bugs can live on surfaces, but probably the majority of that transmission is human to human, where they're actually in the airplane themselves. So do you have plans on, once this gets to a certain level of market, to actually look at the question and say, are these machines, once they're being used, really changing how influenza spreads or something along those lines?
It's a good question, and nobody knows. First of all, we want to make it clear, we can't protect you from the person sitting next to you hacking away. We don't do that. But I don't know the percent of illness that comes from the person sitting next to you as opposed to the person that sat in that seat 2 days ago. And the problem is there are no baseline data because airlines are not interviewing the passengers. When's the last time you got a call from your airline and said, hey, you flew with us a couple days ago, how you feeling? They don't do that. And so we don't have a baseline by which to compare future data. But it'd be really interesting. One of the things we were working with an airline that just got taken over last year, we were going to look at their flight attendants' illness rates before and after. We even talked about putting placebo units on board to look at, to do a blinded study. For the non-doctors, it's kind of where, anyway. But to see if we can make a difference in flight attendants' illness rates.
So I think that's a great, you can do that at a very small scale when you talk about private airplanes, right? So not necessarily that it's just one user, but people now rent these commercial private airplanes that are smaller scale, but you could potentially start looking at those questions, and then certainly the gateway into that market, it might be easier than the commercial airplane.
But a lot of it's perception, and we want to change the perception.
Thank you very much.
Thank you.